surprised to learn that one of the most impressive changes in a woman's body during pregnancy is her heart. Here to share some heart-healthy tips is Dr. Nandita Scott, co-director of the Corrigan Women's Heart Health Program at Mass General. Dr. Scott, thanks so much for joining us.
Thank you for having me.
So let's start first by having you answer here. What are the most common heart-related risks?
So I think what a lot of people don't realize is that when you're pregnant, your heart and cardiovascular system has huge changes. So your blood volume increases by about 50%. Your cardiac output, which is how much your heart has to push out, goes up by 50%. And for most women, this is not an issue, and we have our babies very healthily. But as we're seeing more women enter their pregnancy older with multiple pregnancies, as we're seeing childhood cancer survivors who've survived their cancer therapies and now with heart damage, and a lot of these populations, we're seeing more women with heart-related conditions during their pregnancy. So they can be as simple things as high blood pressure and gestational diabetes as well. But some women have complications, including one that I wanted to highlight, which is preeclampsia or gestational hypertension, where your blood pressure may go up during pregnancy and you may get protein in your urine, and this may cause complications to the mother as well as the baby.
Is that something that goes away after delivery? Is it something that stays throughout?
Generally, women improve after they deliver, but what a lot of women don't realize is once they've developed preeclampsia, there's actually very good data that increases their risk of cardiovascular events over their lifetime.
And as these things are getting more common, are you finding newer treatments for them or prescribing more medications for women? What's the treatment method?
I think the main thing is awareness that these things can happen. Another big problem is more women entering their pregnancy more overweight, potentially having high blood pressure or diabetes before they're pregnant, and it's awareness that these problems can develop and being prepared to deal with them when they occur.
Is there any way that women can prevent these heart risks over their lifetime?
I think any time a woman decides that it's time for her to have a child, she should make sure that her body is at optimal health for that. So one is to see your doctor, make sure that your blood pressure, cholesterol, and you know your general body health is acceptable. If you're on medications, decide if those medications need to be continued during your pregnancy or if there's something that need to be stopped because they may potentially be harmful to you and the baby while you're pregnant.
And if you are at heightened risk for for heart conditions during your pregnancy, is it okay? Is it safe to take medications, or what is the treatment method there?
So it depends on the medications, of course. Obviously there's lots of medications out there. Some of them are absolutely contraindicated. So the cholesterol medications, for example, you cannot take at all during pregnancy because it can cause bony and skeletal malformations in the fetus. It really depends. Aspirin is generally safe during pregnancy. So it's obviously there's a big spectrum of what can happen. You know, for preeclampsia, you know, that's generally treated by obstetricians. It may be bed rest, you know, in hospital or at home, or delivery if there's compromise to the baby.
Not every woman has preeclampsia, but you know, what are some ways that women can stay heart healthy throughout their pregnancy?
Right, so exercising, of course, and to the level that your doctor says it's safe. Eating healthy is good for you and the baby, and just, you know, going to your routine visits and making sure you're doing everything you can to keep everyone healthy.
Thank you, Dr. Scott, for that interesting information. And for more health news, you can check out boston.com/health. I'm Lara Salahi, and until next time, be well, Boston.